Good afternoon. This is Dr. Bin Yang from Dentart, Chicago. We often have a lot of questions from our clients about dental veneers. Today, I will answer some of the questions. I hope this can help you. What are dental veneers? On the tooth, and we normally will cut down a thin layer of the tooth structure, and then we can make a shell veneer on the top of the tooth. So because of it is a very minimum invasive, we can save a lot of healthy tooth structure. So that's why we call that as veneer. What problems can be solved by the dental veneers? So if we have a patient have the gap between the tooth, or staining of the teeth, or malposition of the tooth, so all those can be corrected by dental veneers, which doesn't including, like a very severe malocclusion or very large space. So as long as the space is about 2 or 3 millimeters between the teeth, so that can be manageable. Dental veneers are permanent or let's say definitive treatment option. It is not a removable one. What you would expect, for the steps to get dental veneers, so that will including the first visit, the doctor will do thorough examination, and we make sure the teeth are healthy, the gum are healthy around, and then we will take photos intraoral scan, so we can do a very well treatment plan with wax up, and then we can make a mock-up in your mouth or make the mock-up photos, so then you can visualize what you look like with veneers. And then if you agree with how that's looking, so we can prepare the teeth, take impression, and then we will send impression to the lab, so we will get the veneer delivered for the next visit. Will the veneer match your teeth? Yes, that's a great question. So normally if your own teeth have a normal shade, so we can easily to match. But if your teeth are very dark or yellowish, so in that case, we can definitely do the bleaching before we do the veneer. So then in this case, you get a whitened tooth, so then we can make the veneer to match your teeth very well. Of course, if you choose to have the dark color veneer to match your teeth, and if you don't want to have a bleaching, that is totally doable too. So the pros and the cons for the dental composite or dental porcelain veneers are including the pros for the composite veneer are we can do that directly intraorally, and that can save the time, and also the cost wise is less expensive. However, the cons is include composite, we do that intraorally, and then the smooth may not be good as ceramic, and also over the time it can become a little bit like a staining, especially if you drink a lot of coffee or wine, so that may get a staining on the composite veneer. In contrast, dental ceramic or Emax ceramic veneer, so because of this is a ceramic or porcelain, right? So it's very strong and also has less chance to get a staining from the food or drink. So but the cons for porcelain or Emax veneer will be a little bit more pricey, but over the long time, so the the investment is very worth to do it. So as a prosthodontist, so we do a lot of Emax or porcelain veneer, so that will be definitely a great option for you. Of course, if you choose to do composite or bonding veneer, we can also do that for you. How long it will take to place a veneer on your teeth? So from the examination, diagnosis, treatment planning, and is 1 visit, and then second visit is mock-up, so then we will prep, and then third visit you will get in. So in our office, this process will start around like 4 weeks to 5 weeks. So we will get the final product delivered in your mouth. Do dental veneer need special home care? Yes, that's a great question. So because of the dental veneers are made with composite or IMAX, and we need to make sure it looks great, and also over the time it function well, right? So that's why during the treatment planning, I will check your bite, make sure this type of veneer is in harmony with your function and the lower jaw movement. So second one, you need after delivery at home, you need to brush, flossing every day, and also wear the night guard, which help to prevent you clenching or grinding on the veneer over the night during the sleeping. So that can help to get you longer outcome. How long do veneer last? If it's a composite veneer, and as I said, during the time, over the time, it may get staining, or it may be a little bit like less strong as than the ceramic. So that's why composite veneer, maybe after a couple years, so the shade will look a little like different from very beginning. So that can be one tricky part. And then for IMAX or porcelain veneer, so normally is 10 years to 15 years. So that's a average, the longevity for the ceramic veneer. What is the cost for the dental veneers? That depending on the materials. If the veneer is made of composite, so the cost will be less expensive. And however, if it's IMAX, this need an additional like a ceramist, special ceramist to make that one. So that's why the cost for ceramic veneer will be more expensive. Of course, if you want to apply for financing, that is great option. You want to invest that into your, the aesthetic, and also that help to build up your confidence, for the life. So that's great, actually a great option. Does most dental insurance cover the veneers? Based on, the etiology or the reason, let's say, if the tooth had root canal treatment or fracture, so dental veneers may be covered by portion by the dental insurance. However, if it's only purely for aesthetic, let's say for example close the gap, and so that may be hard. So of course that also depending on your dental insurance coverage and policy. So we will help you to look into your insurance benefit and to let you know before we start the procedure. When should you schedule one appointment for the veneers? That's a great question. Life is short, right? So if you want to enjoy the life and be very confidently to smile, you call us, 312-929-4783. You can, schedule appointment and to see Dr. Yang. That's anytime, not late, right? All right, so I hope today I having been able to answer some of your questions. And so if you have additional questions, please feel free to call us 312-929-4783. I can share my expertise, opinion with you. And also we are here to help you as always. Thank you.